been a huge connection between exercise and physical fitness. The benefits are endless. From losing weight, strengthening muscles, or lowering the risk of heart disease, exercise has always been thought of as a super beneficial way for the body to grow. Only recently has it been introduced as treatment for cognitive and emotional issues in the human body. A main focus on this realization started in the 1980s by Dr. Blumenthal. Though his research wasn't extensive, he was able to spark an interest in what exercise could benefit. A study took place in 1999 with 156 women and men who suffered from depression. They were all asked to work out every day for 16 weeks and report back with how they felt the depression had changed, if at all. It ended up that every patient's depression had decreased by the end of the trial. This then got other scientists intrigued on the topic. What every scientist had in common were three main questions. Which exercise affects moods the most? What intensity is the best and for how long? And should the patients just be working out or should there also be treatment? Before being able to answer these questions, though, there had to be answers on how exactly the brain reacts to exercise. Just as you start exercising, your heart rate goes up, sending blood, oxygen, hormones, and neurochemicals through the body. Your body originally registers this as stress, but then it releases other chemicals to allow the body to adjust. In order to get more insight into these ideas, I turned to two teachers who know different aspects of exercise and its effects.
Bob McFarland, and I am a physical education and special ed teacher at Los Altos High School.
My name is Megan Block. I'm a social studies teacher here, so I teach U.S. history and AP psychology. So exercise is super awesome for your brain and your body in general. So if you're exercising a lot, your body's going to release endorphins, probably some serotonin, maybe some norepinephrine, all these chemicals that are going to elevate your mood, your level of arousal, thus just making you feel better and happier. Exercise can also promote neural growth, so it can stave off things like dementia and Alzheimer's and keep you really mentally there. And sort of slow the aging process of some of your brain.
Something special about exercise on the body is that because your body thinks that it is stress, when you're actually in a stressful situation, your body is able to handle it more easily than without exercise. The chemicals released in your body also seem to mimic chemical effects of antidepressants by increasing brain-derived neurotrophic factors and increasing the effects of the drugs that the patients may be on.
Absolutely, I believe exercise is a huge factor towards, removing anxiety, removing depression from an individual. I think it's a pivotal factor. In fact, that that people get out and get moving and get active. I think that when someone works out consistently and they have that time, whether it's in the pool and they're swimming, whether it's on the track and they're running, and they're kind of just letting their mind go with a focus on something that's like as simple as the next step, the next stroke that you're taking, whatever it is, and you're working at a high intensity level. I really believe, and I think a lot of people would agree, that when you're in that mindset, you're in that mode of running or swimming or what have you, riding a bike, that your mind is free to sort through your issues, to sort through the things in your life, and you can kind of come to some healthy conclusions that you just can't come to sitting on the couch sorting through things. That there's something about having your breath and the consistency of your movement, and that you're focused on this simple task. It's something about that frees up your mind, in addition to the fact that your endorphins are being released. And when you have a chance to sort through life in a healthy way like that, and you're feeling more relieved of those tensions because of the exercise, and you're getting in better shape, and you're potentially losing weight, yes, you're going to feel dramatically better by implementing an exercise to your daily regimen.
I don't know about students that I teach, just because I don't always know if they have depression or anxiety, but you're absolutely right that exercise can really help with both of those things. the psych textbook we have and additional research I've done, yeah, definitely explains that sustained at least 30 minutes of some kind of moderate exercise per day can really make a huge impact in terms of both anxiety and depression. Obviously, that's not always enough to deal with those issues in their totality, but that with some kinds of other therapy and things like that can often be really effective. I think 60 minutes of exercise would be great a day. I think that would definitely elevate levels of certain chemicals that are going to make you feel overall much better. I've heard even just 30 minutes a day, but that might be outdated research. But I would say, yeah, at least 30 minutes a day. 60 minutes would be even better for somebody who has anxiety issues, depression, wants to stave off things like cancer or even something like diabetes if it runs in their family, heart disease, anything, not just mental health, is benefited by exercise. So super imperative to try to make that a part of your day.
You know, I don't know that it takes that much. I mean, it'd be great to have 60 minutes a day. I don't know that that's super realistic with a professional who's raising a family in particular. I think when you're younger, maybe you might need a little bit more because you just have so much more energy to burn. I think it's about the quality of the exercise. I've put my classes through 3 and 4 minute workouts that are really intense and basically kind of how high do you get the engine revving when you're working out? How hard are you pushing yourself or being pushed to work? I think it has everything to do with it. That said, 30 minutes is, I think, very achievable. 30 minutes a day is kind of the new target for people because that is realistic, and that level of intensity is individualized. Some people that are maybe really obese, it takes it would be a lot for them to walk for 30 minutes, and that's fine. But to say that 60 minutes is 60 minutes. I've seen some people at the gym for 2 hours and they don't even break a sweat. So, intensity level has everything to do with the caliber and the effect of your overall workout for sure.
By exercising, your body and brain are both more ready to retain information, focus, and remember things. From a teacher's perspective, this can be seen directly.
I don't get a chance to look too much at the grades of students, but you can definitely tell on a life scale. I've known enough people and seen enough of students' grades over the years to know that they're a little bit more sound, a little bit more organized, a little bit more in tune with their bodies and kind of functioning on a mental health level if they're implementing an exercise. I've really seen that in my own life and in my family. My wife went through periods where she was pregnant or wasn't exercising, or we were in a state where the kids or whatever factors, she wasn't able to exercise, and you could literally see her kind of going crazy versus when she does get out and exercise, it seems to calm her, give her a better state of mind from anything, just how you feel day to day, but also kind of just your emotional health, your confidence. Those sorts of things have been very prevalent in, I think, anybody who's worked out over a period of years and then not worked out, they can really tell the difference in how they feel.
In order to truly feel the effects of exercise on my own mental health, I decided to give up working out for 5 days. Though this was hard because I am used to working out every day, I really did feel my mental mindset change after just a short amount of time. After the first day, I felt much more tired than usual throughout the day. As the week went on, though, I became much more irritable and tired. I could feel my body physically getting weaker, which also may have had a role in why I did not feel normal. Though I did not suffer from depression or anxiety, it was interesting to see how my attitude could change over a simple thing like exercise.
There probably isn't enough education around it. I know when I teach the weight training unit that we go into kind of the benefits of exercise, a little bit more depth in that unit, but I think looking at it now, me personally could probably add in more about the benefits on your emotional health. I think that would take some research. I don't think that that's something that's really taught, at least wasn't taught 20 years ago when I went, 25 years ago when I went through the program.
So I would say I don't know what the sort of curriculum is in our PE classes. If that's something that's not addressed, I think it definitely should be addressed there. And I also am not quite sure exactly what is taught in terms of the curriculum for our health classes. But I think it should definitely be something that is promoted and taught about at multiple levels. Our schools really put an emphasis on mindfulness and wellness this year, which is wonderful. And so I think trying to not just stress like growth mindset and your sort of mental inclination to, strive to overcome failure, but also really emphasizing the impact of exercise would be awesome.
Though exercise can be very beneficial for most people, it is not a cure to these diseases. Doctors do still prescribe different drugs that help greatly. Paired with exercise, though, the patient is more likely to see a better change. It can be hard to fit exercise into a busy schedule, but as you can see, there are so many benefits that are worthwhile to get up and get active.